I know, I did poorly. Hold on, you're in here, but now I'm all flustered. So, headaches, there we go. I give myself notes. I'm probably not going to list every single degree you have because there's so many. She's a doctorate in chiropractic. She also has a master's in nutrition and human performance. She's a certified personal trainer. She runs marathons. It's amazing. I do triathlons too, don't you? Ironman. She does Ironman too. And there's a lot of sports modalities that she's trained in, but I only list yoga because I'm biased. Postdoctoral training in the fields of clinical nutrition, functional medicine, traditional Chinese medicine, and herbal therapy. And I asked her to come today and share a little bit about how she handles migraines, since she has such a various background that she can kind of contribute to one issue. Oh my God.
Thank you. Well, we all love Jessica. Thank you for sharing your story. I met her and if you're in this field, you probably have heard the word epigenetics before. And I love epigenetics, and that's the power of the mind, the power of our environment, the power of what we take in to change our nature and who we are. And you can see that's what Jessica has done, but she radiates light and positivity for healing yourselves, and a beautiful practitioner in healing others. So I met her, so I am just down the street from her. My name is Dr. Robin. I am a functional medicine practitioner. I started off in chiropractic with also a master's degree in nutrition and human performance, and then really found functional medicine. So what I do is integrative care, also do acupuncture and Chinese medicine as well. So today we're going to talk about an integrative approach to headaches, is what I was asked to speak on. So starting off, anybody in this room ever experienced headaches? All right, or have patients that do, okay. So most everybody in here. So what a wonderful topic to talk about, especially looking at an integrative approach on what we can do to look at it. So anything we talk about functional medicine is looking at the root cause, and what is the root cause. So when we look at headaches, first we have to define them. There's a lot of different types of headaches. When you go in order of priority or the most popular, you have the tension type headaches, you have the migraines, you have the cervicogenic headaches, you've got the medication overdose headaches, and you also have sinus headaches, and then a few others that are in there. But when we talk about tension type, that usually is 40 to 60% of the headaches that are out there. So from a functional medicine standpoint, we kind of step back and we look at the big picture to find out what is the root cause of what's going on here. In chiropractic, it was kind of cool because they ingrained in us, looking back at the root cause, we called it the 3 T's. We use the term thoughts, toxins, and trauma. So very similar to mind, body, spirit, or also if you talk about it or kind of hear the emotional, chemical, physical, as those kind of going there. So with headaches, I thought I'd start off and kind of tell the story of how I first got into working with or treating headaches. When I was in school, I was doing chiropractic care, but I really fell in love with functional medicine and kind of the root cause medicine. So I did an internship in a clinic that was called the Somatic Visceral Center, or the Visceral Somatic Center. What does that mean? With chiropractic, we believe everything works from the nervous system. Between every vertebrae, you have the nerves that control every organ, tissue, gland, or function in the body. So if you have a misalignment, that can affect that tissue or that gland. So that's looking from the outside in, where we're going to, well, still the inside out, but we're going to adjust the nervous system, and that's going to affect the organs or visceral. So we call that somatic visceral. Where the clinic I was at, we're like, let's look at visceral somatic. What happens on the inside, and how does that affect the outside? Right? So as I was an intern starting off brand new, I had a student come to me who I knew was a friend, and he had these chronic migraines. And he went to every other doctor who was at the university, all the specialists, all the neurologists. They did every single test on him, and nobody could help him. He was about to the point of failing out of school because he had the true migraines, those that know those, has the aura, one side, but then the vomiting and throwing up. So was not making it to all his classes, but was missing his exams. So it was kind of his last chance, and he's like, what can you do to help me? But he came with the approach of, what can you give me? Right? Because we look at what can we give somebody with these use of medications, or whether it's supplements or this or that. And I stopped and I said, let's start and see what you are eating. right? And I think sometimes we forget the basis and going back to the simple things that people need. So I look at his diet and I was surprised how he could not have headaches with what he was eating, because it was the standard American diet. We call it the SAD diet. We all know the standard American diet of processed foods, whether that's pizza, things that aren't true, foods from Mother Earth. I always call it, if it comes from Mother Earth, it's natural. When it comes from processed foods, it's got so much other stuff in it. So I started off with a basic do an elimination diet. And that one has kind of become my real favorite when it comes to headaches, because the most common type of headaches are your tension. Those ones chiropractic is beautiful with. We can help those easily. But those migraines where you don't know the triggers, that's where you go deeper and find out what the triggers are. So for him, we did elimination. His headaches 100% went away. He was able to go to class, and he found the trigger when he added back in gluten. And yes, gluten we know is a very common one, but those headaches would come back. So that's where I began studying, okay, how does this food, affect us? But not necessarily, I know we hear so much about the issues with gluten, but started studying more on the chemicals. And what we found is it's not necessarily just the gluten or that it's so much more potent in today's food, but they use glyphosate on all of those wheat crops, which is a neuroendocrine disruptor. And so that chemical is, affecting us in the change. So when you look at different foods, what foods do they use that on? Well, most all the gluten, most all the processed soy, corn, and sugar beets, which are the top foods that are in all of our processed foods that we're eating today. So in today's practice, there's a lot of clinical testing we can do. So what I do is do testing to find the root cause. I love doing food sensitivity testing if they can afford it. If not, we do the basic elimination diet so you can find what those triggers are for them and headaches. I didn't start the clock at the beginning, so let me know when to stop. So I thought I'd go through just some of the other things that we look at, but the most common one is tension headaches. Who here has heard of upper cross syndrome or tech neck? Okay, tech neck's the only couple, okay. So that one is just for you since it's the most common type of headaches. You probably notice you get headaches when you're working too hard, you're stressed, you're staring at a computer, you're looking at a screen. When we're at computers, we're sitting down, we find ourselves rounded and then looking up, so the head is forward. This creates what we call upper cross syndrome. It's a cross between the tight and the weak muscles. So here we get tight upper traps. Well, guess what? They come all the way up and they connect to the top of the head. So when they're tight, they pull on the back of the head to cause headaches. We get tight pecs, so we're rounded, cutting off lymphatic system flow, immune system. We get weak lower traps and then weak deep neck flexors. So you guys can leave with something today. There's a guy named Brugger's. He named a posture after himself. But I'll let you all do it. Anytime you're getting that tension type headache, you want to correct those. So you can correct all of that just by sitting up nice and tall at the end of your chair. Now think about where your ear is. The ear is supposed to be right in line with the tip of the shoulder. Every inch is forward, these upper traps are working harder to hold your head. So if you bring your chin back so the ear is in line with the tip of the shoulder, we're not looking up, we're not looking down, we're just bringing it back. If you give yourself a double chin, you're probably doing it right, so you'll look nice and funny. So you bring the chin back. Now usually we're at a computer, we're typing here, so we're rounded. So we want to do the opposite, bring those palms up. And then I'll show you here, we hold it for 20 seconds. Both palms up, bring your thumbs back, and tell me what you feel there. So we're squeezing between the lower shoulder blades, we're opening the chest, the head is back. Right there, you can hold that for 20 seconds. It's gonna help strengthen those muscles that are weak in the back. If you have a band, I give my patients a band and we can do reps for that. And that is recommended every hour you're sitting at a desk, or anyone who's at a desk job. So there's your little home exercise, which is gonna open that up. There's a lot more exercises you can do to help with that. But those are your most common type tensions. Now with headaches, you cannot talk about headaches without talking about water. And I remember seeing on a shirt once, it's like someone takes some medication for his headaches and then another one for a side effect for that one, for that one, for that one, all because it's just too hard to drink enough water. So hydration is one of the number one causes of headaches. Do we know how much water we're supposed to drink a day? So I love it's different for everybody, right? Because we are all unique. But the most recommended guideline is take your body weight, divide it in half, and that's how many ounces of water a day. Now, to go off Jessica's talk is we talk about drinking water, but guess what? It does have to be clean water, right? So one of the common reasons I find people come in with headaches as well is toxins. I do a lot of testing, we're especially here in Florida, for mold, heavy metal, and chemical exposures. And a lot of those chemicals can come from water. We are very lucky we are in Florida, and DeSantis just passed a law that they are taking all fluoride out of our water. I can't believe we can still put chemicals in waters that you can't control and people are drinking it. So drinking clean water, making sure you have a source of purified clean water to drink is, hydration is going to help your joints, help your muscles, help every part of your body. So hydration is definitely there at the top. When we talk about those migraines, we talk about nutrition. Of course, most people, I think it's the things that they need to cut out that they're eating, the bad food. The number one research nutrient deficiency related to migraines, though, is magnesium. When you talk about magnesium, you probably know there's over 20 different forms of magnesium. So there's a lot of different types. But there's only one that's done research to cross the blood-brain barrier, and that's your magnesium L-threonate. So that one's going to help with those migraine-type headaches. But if it's the tension-type headaches, your other magnesiums are going to do great to kind of help with releasing tension and stress. If you're constipated, just take magnesium citrate, though. No? I haven't yet had a person that citrate. You just dose it to bowel tolerance and it flows out of you. But citrate isn't as good for those magnesium, for those tension-type headaches. Glycinate is your best for stress, for sleep. So looking at the different forms of that definitely help. I love the lecture that we had looking at the gut and the microbiome. So the next common test I do after blood work is going to be stool testing, looking at the gut and the microbiome. But leaky gut, leaky brain. If you've got a leaky gut, you're not absorbing your nutrients. You're not going to get those nutrients in so that you can function optimally where your body needs to. And then hormones, of course, some of us know we get the headaches around our menstrual cycle. So it can be that time of year or a month. But with hormones, we also look at cortisol and stress response. So in functional medicine, one test I do often is called the Dutch test. So it's a functional medicine test looking at cortisol. We can't just look at one point, but you look at 4 points throughout the day. But then you look at all your hormones and the metabolites and the pathways and detoxification. One of the common causes of headaches is not having open detoxification pathways, so you can't properly detox and get rid of whether it's hormones, whether it's mold or toxins or chemicals. Sometimes, I had a patient come in this week and she's just ready to get started. Her psychiatrist referred her to me and she's full of mold, but she's not even close to begin a mold detox pathway. So she has to open those up and begin clearing and make sure she's going before, because if you just start someone to detox and they can't detox, you get what's called Hertz reaction, and guess what? That's going to cause a headache and make it worse from there. So we get one step at a time to kind of help these people. We talked about environmental, and I think we talked about those. I know we've been a lot of time. So those are the most common types of headaches. We dig deeper in functional medicine. We always start with a full blood work panel. What's hard is there is kind of a split where we can see in America it is run by insurance. So insurance just says, oh, these are the blood tests that we can check or we can look at. So people often think, I had all my blood work done, everything is normal. But they don't look at everything. So when people first come in, especially headaches, you have to roll out the obvious. You have to look at markers for inflammation. You have to make sure they're not anemic. You have to look at iron, ferritin, CRP. You have to check magnesium. I don't know why magnesium is not a part of a conventional CBC. They don't look at that. So you got to see what's going on and really investigate. And that's where functional medicine and integrative comes in, where you step back, you look at the big picture, and you use the different tools that you have so that you can best help each individual. So that was a lot in a little bit of time. But any questions on tension type headaches, functional medicine, or integrative medicine?
What's your favorite recommendation for someone who has onset of a terrible migraine to ease the pain?
Good question. So with the onset, I do use a lot of supplements and herbs for that. And so of course, oftentimes the go-to is the medications, and when people come in, they're on these NSAIDs, which wreak havoc in the gut and lead to leaky gut and all the other issues there. So I use the top known natural approaches to inflammation when it comes to herbs. Top is going to be fish oil. Clinical dose is 2 grams of EPA and DHA combined to help. If someone has an onset of a headache, I will double that and do 4 grams. So you're looking at how much EPA and DHA is actually in there. Top company with fish oil is Nordic Naturals. And a lot of other ones probably have higher doses like that as well. But fish oil, you just have to make sure they're clean and you don't have mercury. So make sure you have a good clean
And there's a
source.
super cool trick in Ayurveda. I don't know if I'm sure other practitioners know this, but it does not get to the root cause of a migraine, but if you know any of a symptom or trigger 15 minutes prior, you can take a shot of ginger. Just carry ginger powder around with you in a drink. Take a quick shot of ginger, and it's a vasodilator. It doesn't abort the migraine, but it minimizes the symptomology experience or the pain associated with it, and you can use that as a little trick. Some of my clients call it a Hogwarts trick because it just aborts your migraine while you work to get to the root cause.
Thank you. So yeah, ginger is a wonderful herb. My husband always has ginger for nausea.
Yeah.
But fish oil, turmeric is the next top one. So turmeric is a huge one. And then magnesium. So those different magnesiums. I do have another one if it is the tension type headache. Standard process, some of you might know them. They carry a calcium lactate, which is the exact ratio you find in your body of calcium and magnesium. That one I found is really great as well for the headaches, any kind of muscle tension and pain for women. It gets rid of all your menstrual cramps beautifully. So those are the top ones that I go to. So, of course, hydration, fish oil, turmeric, and then your magnesium and calcium are your top natural ways to help with those.
Thank you.
What kind of headaches is the cold compress on the head good for? I've heard mixed things about cold compress on the head.
Good question. Cold is a vasoconstrictor, right? Where heat is a vasodilator. So I would think anything constricting, probably like a cervical genic headache, not so much because then you're constricting, so you're not getting as much blood flow and circulation. But I always tell people there's different things that need heat and there's different things that need cold. When you have a headache, you try it and you see what helps. So you might be better with heat or you might be better with cold. Looking at those different types of where they are. Any other questions? Thank you for having me. That is my website, www.drrobin.com. I do have my information on there. I practice in Dunedin, where we do have a clinic with my husband, who's a chiropractic physician. We do chiropractic, acupuncture, functional medicine. But I practice virtually all across the United States. And so if anybody does need help, or if you are a practitioner and you want to be able to refer patients to me, I can help virtually because it's nice. I can still order labs or order any testing no matter where they are. For blood work, just as long as they have access to a LabCorp, then I can help them. So great to meet you all.